Hey, everybody, welcome to this episode of Compassion and Courage Conversations in Healthcare. I'm your host, Marcus Engel. This is the podcast that teaches compassionate communication, provides perspective, and inspires resilience. And I'm excited today to welcome to the podcast Dr. Carolyn Ward. Dr. Ward, thank you so much for joining me today.
Absolutely, a pleasure.
And so, where do we even start? Can we start? This podcast is a little bit personal and a little bit professional. You want to start with your journey into medicine and then go from there?
Yeah, absolutely. Let me give you a little background about me. So I am an internal medicine doc. So I did all of my medical training in New Jersey, which is where I'm originally from. And after residency, I had done a chief resident year, which is really when COVID first hit in New Jersey. So that was a extremely chaotic time, but really eye-opening for me, I think, as far as not just medical training, but also a lot of how health systems and hospitals are run. Ultimately, after that, I ended up in at Forward, which is a health tech startup practicing medicine focused on preventive care. And it was during my time there that I realized that while I enjoy patient care, I really found a lot of the product work really interesting and impactful. And ultimately, I moved over to become the director of clinical strategy at Particle Health in order to focus and have a purely product facing role. And one of the main reasons I did that is because I really do feel that we need some innovation within our healthcare system in a wide variety of functionalities in order to be able to scale and provide high quality healthcare to everybody in the United States in the future. There is a large upcoming shortage of clinicians and physicians as early as like in 10 years or less. And so I feel highly motivated to make sure that there are physicians and access to medicine in the future when I'm older and I need that. And so I want to be there to kind of help create that new world and create those new systems. And so that's kind of where I am now.
Love it. Love it. Tell us about Particle Health.
Yeah, so Particle Health is an interoperability data platform. So essentially, what we do is we are able to go out and look for patient records throughout the United States and then kind of bring them all back and distill it into a longitudinal history. Why this might matter, and I'm sure a lot of members of your audience are also keenly aware of this, is anytime any of us go to a new physician, you have to fill out like 15 pieces of paperwork about what medications you're on, everything that's ever happened to you in the past. And the onus is completely on the patient to remember everything in your medical history, and be able to convey the importance of certain pieces of information, right? And I don't think that's really fair for a lot of patients. It's very hard to remember, first of all, everything that's happened to you, your family history, every surgery, every procedure, every doctor you've ever been to, all of your lab results. That's not really a fair ask, I would say. But also, more importantly, I would say that when you go in and see a physician, you don't necessarily know what is the most important piece of information that physician is looking for. And on the physician side, right, I often have to get patients to talk at length so that I can figure out, okay, this one piece of information that they mentioned very casually is actually the most important piece of information I needed to know. And what if they hadn't told me that? I would probably make a different decision, right? And so I just think that that whole process is extremely manual. It's very error prone. And what our goal at Particle is to be able to look for those medical records so that we can pull it all together. So when a new physician is seeing Carolyn Ward for the first time, they already have at their fingertips everything that has happened to me in the past, all of my medical records, all of my diagnoses, all of my medications, things I've tried and failed, so that when I go in and talk about a new symptom, they actually have that background, comprehensive clinical context of who I am as a person and as a patient to be able to say, okay, let me create a mental model of who Carolyn is. And now I can plug that symptom in and think about what that actually means for Carolyn.
So, you have to take this back a step for me because I'm not clinical, but what a great service. what a great service, because I have been that patient that you're describing as well, where I forgot. I forgot, and personally,
Of
I don't
course.
even know all the surgeries that I've had, because those were some of those were in such difficult times that I just consciously do not remember. But I love the idea that it's going to give more information to the docs to make a better informed decision. It's like better treatment, better outcomes, best for the patient. What more can you ask for, right?
Absolutely. And it's kind of wild when I explain it to people because they're like, why does that not already exist?
Hmm.
And I'm like, well, for many doctor offices throughout the United States, you want a piece of information, you got to go send a fax for it.
Yeah.
And that
Bureaucracy,
seems
bureaucracy, bureaucracy.
exactly.
Right. Wow. Wow. Okay, so switching gears a little bit. I don't know how much you've looked into my background, but I'm an adjunct at Notre Dame and I teach pre-meds compassion science. And so at the beginning of every semester, I pose these students with a question that I also pose to every guest that I have on the podcast. And that is based on the brief experience that I had with a compassionate caregiver, whose name was Jenny and was a 20-year-old tech who held my hand the whole night that they first rolled me into the ER, and who just comforted me by saying, "I'm here."
Wow.
And so the question that I always ask my guests is, can you share a time that someone was there for you or that you were there for someone else?
Yeah, absolutely. I think the story that I'll share here is it was a very interesting, chaotic, and difficult time of my life. And it is probably actually a very common experience. And that's when I had my first son. Looking back, I probably had postpartum anxiety. And you would think that as a physician, I would have recognized that. But when you are in the moment, it's really, really difficult, as I'm sure you and probably many other people know, to separate out kind of your training, your knowledge from the emotions and the chaos of a lot of personal life things going on. So I had my first son, and I brought that baby home from the hospital. I had never changed a diaper. I had never held a baby. I literally knew nothing. And I was like, I can't believe that people are just allowed to become parents. And then you just go home with no supervision. And they're like, please keep this thing alive. And at that time, my husband was traveling for work full time. So he was gone Monday through Friday. And my mother-in-law had moved in next door to us to help out. And when I had brought my firstborn home, I was extremely anxious. I had a lot of trouble breastfeeding. The baby was losing a lot of weight. I didn't want to switch to formula. I felt that that would mean I was a failure as a mother. I had these like reoccurring thoughts every single time I would walk through like a door frame or there was a corner in the house, like anywhere where like the two walls meet in your
Mhm.
apartment or house. I would have this reoccurring thought or fear that like I was going to bang my baby's head on that door by accident, or I was going to like accidentally, as I'm turning the corner and I'm holding the baby, that the baby's head was going to hit the corner. Um, which, as you can imagine, made traveling in my apartment extremely anxiety provoking. And I remember at that time, I was so anxious. And the only way I could think about controlling that anxiety was to try to control everything in my environment. Like I wanted everything to be exactly right, all the bottles lined up, the baby to be on a very specific schedule. I was like, this is the time that we're going to eat, we're going to sleep, we're going to be changing diapers. I literally tracked every single little thing about this baby on an app. Um, and I was just crying nonstop. And so at that time, I bring this up to say that at that time, my mother-in-law would come over during the day to help me. Obviously, I was on maternity leave, and I was also in residency when this happened. So I went from one very anxiety-provoking experience to another.
You were
Um,
in residency.
yes, and
In
that
residency. Wow.
that was also an interesting experience because for a lot of residency programs, if you do not want to delay your training, you have to like pool together your vacation as maternity leave. So basically for a year and a half, I took no vacation so that I could have 6 weeks off with my newborn. And so I worked up until the day that I gave birth, and I was working like 16, 18-hour overnight shifts in the ICU. And I will say, luckily, that my pregnancy experience was really smooth. And I feel like because it was so smooth, I was like, I got this. This is no problem. I'm like 7 months pregnant, working the ICU at nights, like no problems. I was like, this is the bag. Like, I'm not going to have any issues. Um, and then when the baby actually came, I was, you're hormonal, you're emotional, and I was just a mess. And my mother-in-law would come over during the day, um, because a lot of times I would otherwise be alone. And I would just, it was really mean, to be honest. I was snapping at her. I was crying at the drop of a dime. I was extremely particular about how I wanted my baby taken care of and handled. But to your point earlier, a lot of the times, like she would just be there, like not necessarily saying anything or even doing anything or stepping in, but just there. And looking back, I realized that actually her presence in the room was was the compassion I needed at that time.
Mhm.
Sometimes it was just for me to rant. Sometimes it was for me to vent. Sometimes it was for me to cry. Sometimes I just ignored her presence. Like we didn't say anything. She was just there. And I really think that is a bulk of what got me through those first few weeks. And, a lot of times when I afterwards, you go back to work after an experience like that. And, since then I've had a lot of difficult conversations with patients delivering bad news. And one of the things that I always try to practice is to make space to just be silent and in the room because of that experience where I realized that you don't always have to say something. And sometimes there is nothing to say, right? Like, I'm sorry this happened, or I'm sorry you're feeling this way. But sometimes there are no words to say to that person to make them feel better, so to speak. Like, they don't need to necessarily feel better in that instant. They just need to know that somebody's there with them. And for a lot of patients in the hospital, there is nobody with them except for the clinical care team. And so I think a lot of the work that you do, especially with the pre-med students so early on, is really important because I do think that that is a extremely important part of being a clinician. Um, and I'm interested to see where that goes in the future with the advent of, generative AI and apps and
Mhm.
telehealth and things like that. But ultimately, I think it is what makes the practice or the art of medicine an art, is that humanity in the care delivery. And so, anyways, yeah,
Well,
that's my
yeah.
story.
Well, thank you for that. Thank you for sharing that. And that kind of segues right into the next thing that I was hoping to talk to you about, which you mentioned, which is telehealth. And
Hmm.
so, how do we? It's one of the questions that I've wrestled with, and I think most thinking people will wrestle with this question. How do we be present and compassionate for patients when we are not physically present, right?
Yeah,
how do we practice presence when when you and I are sharing time right now but not space? How do we practice presence when we can't physically be present? And I for one, as a person living with vision loss, I love telemedicine. I love that we came out of the pandemic with more options for telemedicine all the time, just because of the barriers for transportation. And
absolutely.
but I do at the same time, while I love telehealth, I also have to say, how do we give that presence when we're not physically there? Any thoughts on that?
Yeah, that's a really good question. I actually think about this a lot because a lot of what I think about and do currently in my role is is really focused around how do you use clinical data that a patient generates to understand something about them and create something, a product, or enable the creation of a product by our customers that either speeds operational efficiency, makes it so that a physician can scale themselves, which ultimately means that less in-person FaceTime, right?
Mhm.
And it probably ultimately also means less telehealth FaceTime. Like, I think that there are a lot of companies out there now that are looking to say, like, what are all the use cases in medicine that we no longer need a person to do? And like on the one hand, I'm thinking a lot about products, a lot of that in that product space. But on the other hand, a lot of what we're talking about is that compassion that really can only come from a human, um, and that presence, right? And the way I kind of think about that is kind of in two different ways. The first way I'll say is you can certainly be in front of a person and not be present, right? I think that's why there's been a lot of emphasis in healthcare about, oh, well, I go in to see a doctor, but they're just behind a computer screen typing away. Or, I go in and see my primary care physician. I've already seen them 15 times. They still know absolutely nothing about me. And I think a lot of that speaks to this extreme fragmentation of healthcare data, leading to a very generic, non-personalized experience in medicine. I think what a lot of people are looking for is when you go and seek healthcare, that the person who is delivering the healthcare to you and making those decisions knows you, right? And they understand who you are, what has happened to you, not just from a clinical standpoint to make the best actual treatment decision, which is also very important, but also in the actual delivery of that care, right? Like, are you able to get access to medication? Do you live in a place that is in a food desert? Are you able to get access to healthcare? Are you able to go to an urgent care? Do you have a primary care physician? Things like that, where there are just kind of things that are happening in your life that may limit your ability to carry out some kind of treatment plan. And so I say all this really to say that I do think that there is a lot that we can do to personalize medicine, which I think will actually help with the feeling of presence in the sense that you feel secure in the care that you are receiving. But on the other hand, I also think that there's a lot to somebody being there for you, like an actual human being, knowing
Mhm.
that there's a human on the other line as opposed to like a chat bot. And I think one of the things that I would really love to see, I think we will get there in the next few years, is a real clear delineation. And there's probably a lot of gray zone, but an understanding of like, what are those moments where that is the most important, right?
Mm.
And the
Mhm.
example I give a lot is Wobot. It's an app that does cognitive behavioral therapy exercises for people with looking to improve their mental health and who have depression. And they have really good clinical outcomes. And the interesting thing about Wobot is it's a chat bot. There is not a real person who's
Yeah,
texting
yeah.
you back. And why is it in that instance that people can still get those great clinical outcomes doing those cognitive behavioral therapy exercises with chatbot? Like, that is an experience that has traditionally only ever been done with another human, like two humans in a room together. Um, but Wobot was able to replicate that. And I think part of that is the fact that they didn't try to pretend that this chatbot was human. They're like, this is a chatbot. You are chatting with a computer. And I think that when people realize that, they're like, okay, like I will change the conversation. Like, I have that expectation. But that type of exercise is not replicable across all types of healthcare experiences, right? Especially extremely traumatic experiences.
Mhm.
Delivering bad news. You probably don't want that coming from a chatbot, right? Making hard decisions, end of life care, right? I think a lot about those types of scenarios. And I think that we should think really deeply about what are the places where we can use clinical data to make that personalized touch that will actually probably be a better experience than what we have today. And then where can we concentrate manpower on the areas where we know a robot or a computer can't show that kind of compassion, can't reach that need for people. Um, and I think that that will help us to understand like what will medicine look like in the future?
That's the question, right? That's the question.
Mhm.
What is it going to look like in the future? Because just recently read Ray Kurzweil's book, The Singularity is Near. You familiar with Kurzweil or his work at all?
I'm not.
He's a futurist. I believe he has three master's degrees from MIT, and he's constantly looking at the future. And The Singularity is Near is a book about when we will, the point when humans and robots will be indetectable from one another.
Oh boy.
And this book, yeah, and this book came out 20 years ago too. So to read through it now and to
Mm.
look at the things that have come to pass, some of the predictions for the future, even though he did talk a lot about AI, but between robotics, genetics, and AI, we are going to see a very, very different landscape for the delivery of healthcare and medicine in our lifetimes. I mean,
Uh,
provided you're not 105 already, but
yeah, I really, really agree with that. One of the things I often say is I think that primary care physicians will probably look a lot more like data scientists in the future. And the reason I say that is because in some ways, the way that if you think about the evolution of medical practice and also medical like training, not that long ago, healthcare delivery was a physician coming to your house to take care of your whole family with a little black bag. And everything that person could help you with pretty much fit in that little black bag that they brought to your house, right? Every tool that they needed, the medicines that they would give you. We are so, so far from that now. We there's just so much more medical knowledge. There's a ton more therapy options. And I think it's quickly getting to a place where it is not really reasonable to expect one human to hold all of that knowledge in their head and then, take in a bunch of inputs from a patient from a conversation and then spit out like an accurate output. I do suspect that like computers would be better at that. I think that there is probably a world very soon where um, you enter your symptoms. Maybe you speak to a computer, it takes out keywords or context through natural language processing. It puts it into a digital twin model that's based off of you and all the healthcare data you've generated throughout the healthcare system. And it gives you risk predictions, right? It is most likely that you have this based off your symptoms. This is the second most likely. That process today currently occurs in a physician's head, and we call it a differential diagnosis. Um, but it's rate limited to that particular physician's brain that you happen to be in front of on that given day. And we being able to pool all of that knowledge together, definitely, I feel like there are some serious strengths there. And also considering there's just not going to be enough physicians in about a decade, we probably have to do that to be able to scale high quality healthcare across the United States. That means that physicians are going to need to be able to understand data and predictive models in a way to understand how to apply them to a particular patient population and cohort, but also to an individual. And that's why I say I think they will need some kind of data science training in their medical training. That being
that'll be a
said,
different, yeah, that's going to be a
yeah,
totally different paradigm for medical
I think
school.
so. I absolutely think so. Um, that being said, again, I also just don't think that we are anywhere close to humans and robots being the same at this
Mhm,
point, right?
mhm.
I think that's definitely still a ways down the road. Um, I think that a lot of like what we hear right now in the medical community is like we don't want AI to replace physicians. We want them to augment physicians, which I also agree
Mhm.
with. And I think that's a great intermediate step. But I think ultimately what we're kind of speaking to is there are certain things that physicians do today that computers probably would be better at. And there are certain things that physicians do today that computers cannot do. And I think we want to use people to lean into the things that only people can do and take the stuff off their plate that they either can't do that well or is getting in the way of them doing the people facing things. I don't necessarily think it needs to be you need an MD to show compassion. I definitely don't think that that's true. Um, and I think that that means that when we think about innovations in healthcare delivery, we also need to think outside of just strictly clinicians, so to speak, and think about people in general and like what is our role in caring for one another. And back in the day, you know, you had your tribal community, you had your neighborhood, you had a group of people that you surrounded yourself with that were pretty much there with you for life. And I think we've gotten really, really far away from that as well as a society. Um, and we're paying for it.
Yeah, we are, with the loneliness epidemic that we
Yeah,
know is out there, and with using opioids to treat loneliness and mental illness and things like that. We certainly understand that there's a separation between uh, who we can be and maybe who we are as a society right now. Well,
absolutely.
points to ponder. Hmm. So,
Yeah.
what's on your reading list right now? What are you reading right now?
Ooh, that's such a good question. I'm like literally pulling up my Audible. So I
Yeah.
actually personally love to read actual physical books that I hold, but
Mhm.
I've got two boys and they're running around. They're 2 and 5. They're absolutely insane. So there's like almost no quiet reading time left in my life. Um, but so I use Audible a lot, like in the car, driving, things like that. I am currently in the middle of 3 books. I have this tendency to kind of like flip back and forth in between readings.
Mhm.
The first thing that I'm reading right now is a book called Competing Against Luck. And it's about how to make innovations based off of jobs to be done, meaning you think about when people are going about their daily life and they come across some kind of issue, they will quote hire a product or some kind of process to solve that issue, and how to use that kind of framework to understand um, how you can actually add value into that process. So that's really, I think, more of like a job development, career development kind of book that I'm
Mhm.
trying to
Mhm.
read for that. The other book I'm reading right now is called, I think it's called like Resilient Kids or something like
Mm,
that. And it's
okay.
really about how do you build resiliency, obviously in the tiny humans that we're raising, but it's actually really good for even applying those lessons to yourself. Um, and a lot of it speaks to like autonomy, which I think also has a lot of implications in the healthcare system itself, but also with raising kids. I actually draw a lot of parallels often to like lessons I learned in parenthood, to lessons that I learned in residency, to lessons that I learn now in product development. But I think a lot of those skills are very transferable, but that also is a really interesting book. And then the last one I just started is a book called Hidden Potential by Adam Grant. And I've only read the first 2 chapters, so can't really speak too much there.
Mhm.
But yeah, those are kind of the three.
Good stuff. Good stuff. I take note whenever people, and I commend you too for working on three nonfiction books at the same time. my my limitation is one fiction and one nonfiction at a time. I can't jump around too much more than that.
I love it.
So, and you say you're originally from Jersey.
That's correct. Yes.
Okay, very good. So let's go back to high school. You're
Yeah.
you're hanging out with your friends. It's after practice or after whatever, after school, Saturday night. What are you and your friends listening to while you're hanging out or driving around?
Wow. Interesting. Let me think. What was like big back then? I would say probably like maybe aging myself, like probably Justin Timberlake,
Mhm.
um, Taylor Swift. Maybe she was mostly big when I was in college. Um, yeah, that's a good
Yeah,
question.
pop music
Yeah,
then of
pop
that
music.
era.
I would say
Yeah,
pop.
gotcha. Good stuff. And so my last question for you, a little bit deeper thinking, but you're obviously somewhat of a philosopher and a forward-looking person yourself. So if you had the world's largest billboard on the world's tallest mountain, what is the message that you would want broadcast to humanity?
Wow, that's a great question. Um, I'll tell you what my gut instinct was when you first asked that, and then
Mhm.
what I actually think I would do now that I've like taken a second. My gut instinct was some kind of message about going for it, like just doing
Mhm.
it, like trying things. I think that one of the things I've noticed a lot is we often are the people who hold ourselves back the most, right? And that could be out of fear, it could be out of insecurity. A lot of times, whether it's applying for a certain job or if it's with children, just, having an idea. They have so many ideas when they were kids. And then as they grow older, those ideas actually shrink and shrink and shrink and shrink because the world's always telling people like, what's the chances that you're going to solve that problem? That problem's been around forever. Or, why do you think that you are the person to handle that? Or what makes you think that, in this case, you can create a differentiated product or you can solve that healthcare problem? And we just need more people to just do it, to
Mm.
say, like, I'm just going to try, just try, I'm going to do it. So that was really my gut instinct because I do think that that is something I would love to be able to tell that next generation. But when I took a beat and I think about everything that's going around in the world in general, I think I would probably say be kind to one another because I do believe that like I do love the idea of like being creative and curious and learning things and building things, but I think that without kindness, we're not going to get very far as a society. We'll just
Yeah.
start on a downward spiral, and it won't matter what we achieve or what we build or what we accomplish in our lifetime, right? And I heard somebody, it was on Instagram actually, it was like
Mm.
a parenting Instagram influencer or
Mm.
something. And one of the things that she was teaching her daughter is um, what's more important than being blank, right? Like being smart, being
Mhm.
beautiful, like it's being kind.
Mm.
And I that really rang true to me. I think that that is true. I think that if you are kind to people, you will learn about them, you'll be curious about them, you'll be compassionate towards them, and that actually probably will drive all the other things. And that's true. I think, a lot of people go into healthcare because they want to help people. And it's also true that I went into healthcare and practicing medicine because I felt like it was intellectually challenging. It was interesting. You're always kind of doing new things. It's very fast paced, all things I love. But there's a lot of jobs where you can make a big difference doing that with those exact same skills. Healthcare is, in a way, very uniquely positioned to be an industry where you get to help people every day. You get to go to sleep knowing you made a difference in somebody's life every single day that you practice. Um, and not many people get to say that. And I feel like, unfortunately, a lot of people are getting to say that less and less in healthcare. And so I really want to be able to bring that back. I think it'll look different. I think it'll look different than the last 20 years of healthcare for sure. But I think it's still something that's really important as a tenet to medicine, but also to humanity.
Yeah. Be kind and go for it. And go for it. I like
That's
both of
right.
those. Especially that go for it is spiritually speaking to me right now with some discernment and thoughts and such here on this end. So thank you for that. I appreciate that on a personal
Absolutely.
level.
Good.
Uh, well, Dr. Ward, I cannot thank you enough for being with me today and sharing your insights and what you're doing and what Particle Health is doing. This has been a great conversation. Is there any websites you want to send people to or anywhere to get more
Oh,
information?
I would just say people should feel free to reach out to me on LinkedIn if they have any questions or anything that they're interested in or want to chat more about. And of course, as always, if you are looking for an interoperability data platform or you want to just chat more specifically about like clinical data use cases and personalizing medicine to patients and for physicians, you can definitely check us out at particlehealth.com.
Excellent. Excellent. Well, thank you so much for being with me. And listeners, thank you for being with us for this episode of Compassion and Courage Conversations in Healthcare. Again, I'm your host, Marcus Engel, and this is the podcast where I teach compassionate communication, provide perspective, and inspire resilience. Thank you to everyone who continues to subscribe and share and rate and review and comment. We appreciate all of your social media activity. Thank you so much, and we'll see you on the next episode of Compassion and Courage.